The broadcast is now starting. All attendees are in listen-only mode.
Welcome everyone to this week's webinar with One Resource Group. I appreciate you all hopping on. This is Jacob Locke, Director of Marketing here over at ORG. And today I'm really excited for our guests that we have this week. This week we have Megan Jenkins and with Amaze Health. For those of you that don't know a lot about Amaze Health, they're an essential piece of our new employee retention plan. Megan's going to go through, give you an idea of what Amaze can offer through what they're offering, while at the same time looping it all together with the employee retention plan. Housekeeping items will address questions towards the end of the presentation. Feel free to ask them throughout and we'll make sure they're covered. So Megan, I appreciate you hopping on. I'll swing it over to you and let you do your thing.
Perfect. Well, thanks, Jacob, and hi, everyone. I'm Megan. I'm a physician assistant by training, actually, with Amaze Health. I also work, of course, on our account management side, but I have experience working in urgent care, pain management clinics, as well as our medical team here at Amaze. So I kind of understand the ins and outs and how our medical team works. And overall, just really excited to be here today to explain Amaze and some of the services that we'll have to offer your clients. So when you first hear about Amaze, you may think that we are a telehealth or a wellness provider, and we are, of course, but Amaze really is so much more than that. Our mission transcends just a mere list of telehealth and wellness services. We're dedicated to being our members' independent healthcare partner, someone that is available with one click of a button, helping our members guide them through the complexities of our healthcare system, empowering them to be good healthcare consumers, as well as taking care of them medically. And so navigator in our healthcare system, as you can imagine, and if you've had any healthcare need or you've had a family member have a major healthcare need, it can be difficult. It can be confusing. Many people may not know where to start, what questions to ask, who to turn to. And this confusion overall leads to higher healthcare costs and actually a diminished overall health and well-being for individuals. People really need an advocate, someone that is here to guide them, kind of be that guiding light or GPS system within their healthcare journey. And that's really where Amaze Health steps in. I've heard this analogy used in the past, and I like it because I think it gives you a good idea of what we do and how we do it is, if you are to travel anywhere, sometimes even just going to the grocery store, you're going to use a GPS system in your phone, right? Something that's going to provide you with directions, make sure you get there safely and efficiently. And that's really what Amaze Health is. We are that friendly provider in the back of your pocket, here to answer those big and small questions and help you navigate any of those. So what I really encourage any new clients, new patients, new members is I will discuss a ton of different services that we offer here at Amaze. But if you just remember one thing about Amaze Health is that you should always start with Amaze. Our providers are available 24 hours of the day, 7 days a week, and we're nationwide. So you could be traveling out of state, on vacation, in Mexico, for example. You always have access to our medical team, again, with one click of a button, here to answer those big and small questions. So I will kind of highlight our services in three big pillars, I like to call them, of the services that we offer. The first one being prevention. Prevention is, of course, very big, especially in these programs, and promoting overall health and wellness, and promoting individuals to really take an active role in their health and wellness. And so we have a chronic care team here at Amaze that offers primary care services. So if a employee or a member does not have a primary care provider, we can assume that role. We can refill medications, we can order those annual labs, place referrals if you need to see a specialist, make sure you're up to date on your recommending screening tests. And we're gonna do so by not only providing these services, but also helping ensure that you're getting the best price for services, the best price for your prescriptions. Unfortunately, they can vary just depending on the pharmacy that you fill them at, or the way the prescription was written, whether it's capsules versus tablets. And so we help find and source those medical services, those prescriptions. Maybe you need an MRI, maybe it's late in the year and you are nowhere near meeting your deductible and your health insurance. Our team will research cash pay options and compare them to insurance contracted rates. Sometimes it can be much more cost effective, we'll say for that MRI, to pay $300 or $400 cash, depending on the situation, than paying $700 or $800, which is your insurance contracted rate. So we're really here to help guide our members in making good healthcare choices overall. And at the end of the day, we're here to forge relationships with all of our members. Prevention these days, if you ask anyone on the street, they'll say, yes, you know, I go see my annual, or I go see my PCP for an annual physical, they order my lab work, and that's really it. That's kind of where the line is drawn in today's healthcare system, is just that annual physical. But true prevention really extends beyond just an annual physical. It requires those day-to-day changes throughout the year to really make sure we are, again, promoting our members to take that active role, work through maybe some new habits or other things that they can do to prevent long-term chronic conditions, or at least stabilize them. If members already have a primary care provider, that is phenomenal. We're not looking to replace local providers, but rather work with them, fill in any gaps in care. It can be a busy world out there, and many individuals, as we've just discussed, see that provider once or twice a year. Easy example is, say you need a routine medication refill. You call your provider's office up, and of course, they'll ultimately probably refill that medication for you, but they want to see you in clinic first, right? And maybe their next available appointment isn't for 4 to 6 weeks. And so our team can, step in, we can refill those medications for you, make sure things are stabilized, maybe order your labs ahead of your annual physical, so you can really make the most out of that visit. Under that umbrella of services is, of course, we've touched on it, but health and wellness. So our providers can help individuals towards their goals. Maybe it's weight loss, nutrition, improved sleep hygiene, maybe smoking cessation. We have an entire e-learning center as well within the Amaze Health app that I'll show you here in a bit, where you can go in, you can learn a bit more about any topic of interest for you. It could be, again, nutrition, or maybe some exercises, weight loss. Our topics are all written by our medical team. So I always encourage members to go in and check that out. There's a ton of modules, challenges, assessments available. I do like to note that this is all available on the individual level, but if you have a client that wants to launch a health assessment or a lunch and learn, or anything about a topic of interest to their employees, we can also launch those assessments or challenges or modules on a company-wide level as well, and work with the client directly to launch that. I will pause. I don't know if there's questions coming through, but okay. Don't see any. So I will just keep going and try and check that chat box and question box as I go through. But the second big pillar of services that we offer is, of course, kind of the bread and butter, what most people think of when they think of telehealth services, and usually how patients interact with us initially is when they have a medical need or an injury that they need assistance with. So of course we have virtual urgent care, so cough, sore throat, sprained ankle, maybe a rash. You're always one click away from getting connected to that medical provider who can take care of you almost all of your urgent care needs from the comfort of your own home, or maybe you're at the grocery store dealing with a sinus infection that hasn't been getting better. You can start messaging with our team, and you really get that direct access to care to take care of those needs. I always say that even if you think your issue goes beyond virtual care, call us anyways. there's a high likelihood that our providers will surprise you, and it is something we can take care of from a virtual environment. And if not, we're going to direct you to the most appropriate care, or direct, our patients to potentially an urgent care if it's something that needs urgent attention and to be evaluated in person, or maybe we bypass that altogether and get them in to see a specialist instead, because that's who they truly need to see, saving them time and money along the way. This is a common example. I use it often, but I find that it helps individuals understand everything that we can do from that virtual environment. And so, as I've mentioned, I am a physician assistant. So I have worked in busy urgent care settings, and I've had patients, one patient in particular that I'll discuss, that called our team really to only see if he should go to an urgent care or an emergency room for what he suspected was a broken foot. This happened the day before, and he just wanted to know what were his options. And so we got him on camera. I performed a virtual physical exam. Based on his history and physical, I had pretty high suspicions that he may have fractured his foot, and so we discussed next steps. Instead of this individual going to an urgent care, if you've been to an urgent care lately, it's rather busy, rather overwhelming. You're likely going to spend, a few hours or so in that urgent care waiting room. You're going to fill out stacks of paperwork that, unfortunately, myself as a provider may never see. You're probably going to retell your story 2 or 3 times before you actually get to speak to that medical provider. And this is not the way that we like it, but oftentimes we only have 10 or 15 minutes to spend with our patients in those settings. That provider is going to order an expensive x-ray because it's in an urgent care setting. And then based on those results, likely refer to a specialist for follow-up. We were able to accomplish the same outcome. So I ordered an outpatient x-ray at an independent imaging facility. As I've discussed, my team researched those cash pay rates and compared them to this member's insurance contracted rates. I think it ended up only being $25 for that x-ray cash. He was able to get that x-ray done that afternoon, and I had the results within an hour. Unfortunately, in this scenario, this patient had fractured his foot. So from there, we found him a walking boot and crutches at the local medical supply company right down the street. Oftentimes, we can send you the exact link via Amazon these days for that walking boot that we recommend for same day, next day delivery. All much more cost effective than getting it in an urgent care or an emergency room setting, right? And then while all of that was happening, our team called around, secured him an appointment with the local orthopedic foot specialist in his area the very next day for follow-up. So we get to the same outcome. Honestly, probably more efficiently and effectively than had this individual gone to an urgent care, while also saving them the time, the money, and just the hassle of that urgent care visit altogether. The other big piece that I'll spend a little bit of time on is our mental health model, because it is rather unique, and you can kind of think of our mental health model as a mental health urgent care. We are available on demand. We have an entire mental health practice that you can see here on the slide, and we really want to focus on that in the moment support. So with one click of a button, someone is connected to our mental health team. So say you're just having a bad day and you want to vent through something, or you're working through some increased life stressors, or we have members that call in the midst of a panic attack or a depressive episode, and they are instantly connected with our mental health team, someone that can support them in the moment when they truly need that support. So we have a multi-tiered approach. Like I said, you can see this on the slide. We have psychiatric nurse practitioners. They lead our mental health practice, and they can evaluate, diagnose, prescribe medications for common mental health conditions. We have licensed counselors that offer those counseling sessions, in the moment support, and they'll work with you to develop kind of that individualized treatment plan. And then we have a team of clinical nurses that have specific training in mental health. They do continuous check-ins, support, skill building, case management between visits with our other providers. And then our last level of support is our peer support program. This is not clinical, of course, but really connecting individuals with others that might be going through something similar. Say you're a single parent, for example, we may connect you with another single parent. This is not clinical, but sometimes this is all the support that someone needs in that moment, is just talking through their experiences with someone else. So our program is very individualized. We focus on, again, in the moment, on-demand support, and working towards solutions. And then once someone graduates from our program, then they kind of move to a preventative program where we send updated depression screens, anxiety screens. We're checking in once a month, seeing how they're doing. And if at any point they need further support or those scores start to increase, we pull them back into our program and get them the support that they need. If an individual needs long-term extensive therapy or very specialized therapy, that's when we get them stabilized in our program. But then we may lean and find them some local resources that can really give them the support that they need and case manage it there as well. Maybe, finding those providers, giving a warm handoff to those providers, and then we continually check in even if they're seeing someone locally. So I know that is a lot of information. Let me just check to see if I see any chat or questions come in, and I can answer them at the end as well.
Yeah, looks like I have a few, but we'll answer them towards the end.
Okay, perfect.
Yeah.
One other thing that I like to touch on, just kind of under that second pillar of support, is our second opinions, because this is one that is underutilized. And so very general analogy, but when we shop for any purchase, really, when you are shopping for a new car, a new home, even for groceries, you want to make sure you're getting the best deal for yourself, right? You don't always do that when it comes to making those medical decisions. And it's really important at the end of the day. As a provider, I can't tell you how many times, whether I like it or not, that I have had friends, family members, sometimes it's just my neighbor that's seen me wearing scrubs a few times. They reach out to me. They ask me for my medical advice. It could be something simple like a new medication that they started, or maybe they want to review their labs in greater detail, or maybe their provider is recommending some procedure or surgery and they just want to learn if it's the next best step for them. And of course, I guide them, I support them with unbiased medical advice in any way that I can. And that really is exactly what Amaze Health is for all of our members. As I mentioned, we are that friendly provider in the back of your pocket, here to answer those questions. Members can call us once a day. They can call us 10 times a day. They will never have to worry about a hidden fee, a copay charge. We don't file claims on insurance, so they have unlimited access to our medical team. Our medical team has experience with a variety of specialties, women's health, pediatrics. We have a dedicated orthopedic team and a dentist on staff. So there's really, again, no question too big or too small. And then the third, last kind of final pillar of services that we offer is, of course, our navigation, our advocacy. That goes with everything that we do here at Amaze, as I'm sure you can imagine at this point. But I do like to touch on, we have a billing and insurance team here at Amaze as well that will review medical bills. So I never wish a large medical bill on anyone, but say someone ends up in the emergency room and they receive that large medical bill maybe a few weeks or a month later. I always tell them not to panic. First, foremost, submit it to our team. Our team will review it. They will make sure things were coded properly, you weren't double charged for something, that your deductible was applied appropriately. And if at any point we find any errors, that's when we're, again, going to become your advocate. We're going to work with you, the facility, the insurance carrier, help you through any dispute or appeal processes. Because at the end of the day, of course, we're here to partner with you, and we want to make sure if you do use local resources, if you do need to utilize those benefits, that you're getting the best care at the lowest cost always. So as I mentioned, what truly sets Amaze apart is not necessarily all those services that we offer, but it's really how we do that. You'll see, I'll show the app here in a second, that you're always one click away from speaking to a medical provider. Someone who can actually evaluate you, diagnose, treat, prescribe medications, order labs or imaging right then and there with one click of a button. We really don't want to, or we really want to reduce any friction to speaking to our team. So you're not filling out forms or questionnaires, you're not sitting in a queue for a call back later. You are talking to a medical provider, a physician assistant, or a nurse practitioner. We're also going to follow up with you until everything's resolved. So after any medical interaction with our team, we're likely checking in within 24 to 48 hours, usually via messaging, so not to take time out of our patients' days or anything like that, but making sure that they got their prescriptions, that they didn't have any trouble at the pharmacy, their symptoms are improving. And we continue to follow up until all your symptoms have resolved. Our providers are also all W-2 employees. So I know that might seem, why am I telling you this? But that means that they're not contracted out. They are not just taking calls to make extra money. We're really, again, moving away from transactional fee-for-service medicine and wanting to build relationships with our patients, with our members. We are not paid as a medical provider per call, so we're not pressured or incentivized to take more calls or see more patients. We can spend as much time as we need. And again, as a medical provider, one thing that I've loved working on our team is the collaboration. So we're really, any patient that we interact with has a full team of providers behind them, helping them along the way, whether they're, seeing our chronic care team, our mental health team, maybe working on nutrition, and maybe they have, an acute medical need coming up. Our providers all work together. As I've mentioned, we don't file any claims on insurance. There's no copay charges, there's no hidden fees. All of those services that I mentioned and more are included within Amaze and those wellness programs. And this extends to the entire immediate household. So a spouse, a partner, any dependents under the age of 26, they all have access to these services, whether they're covered under that primary employee medical benefits or they have different benefits. So as you can imagine, all of the services and really, at the end of the day, some of the goals that we have, both on the individual and client level, is reduce those unnecessary emergency room visits and claims, eliminating most, if not all, of those urgent care visits, and even intercepting or reducing the number of specialty visits as well. If it's something that we can treat appropriately here at Amaze, we often, kind of start that treatment. We can use our orthopedic team as an example. Say, again, you twisted your knee, and maybe you ultimately are going to need to see an orthopedic surgeon for that. We can get you started with a treatment plan. We can get you in, either do home or in-person physical therapy, order all the imaging that you may need before you see that specialist. So you're not wasting visits just to do the full workup. We'll get you ready to go and fully prepared for that specialty visit. And then, of course, we guide members towards independent imaging facilities, laboratories, and surgery centers, so they can avoid those higher cost hospital-based services as much as possible. So I will just kind of walk through, just overview our app and a general rollout of Amaze. So once we start a new client, we'll receive a census. Emails are very, very important to us because that is how we initially communicate with a new client, is we will send a series of welcome emails with their username and a link to set their password. Their username is often just the email that we have on file, and that email campaign will also include description of all the benefits of what plan they're enrolled in, what are the other benefits included in their plan in addition to Amaze. We do have a 720 number as well. What I will just say about this number is, one, if you have any individuals that are having trouble getting into their app or logging in, they can call this number. But it's also a way that individuals can speak to our medical team. So if they haven't downloaded the app or they're logged out, they can call this number and still get access to our team. Amaze is, of course, available on any Apple or Android device. You can also log in. Our members can log in online just at amazehealth.com, and they will have access to all of the features as well. And then this is our home screen. So I do like to show this because, again, it is as soon as a member opens their app, they see two buttons: call us, send us a message. And the person on the other end of the line is that medical provider. So a physician assistant, or a nurse practitioner. Most often, initially, members will call us. They don't need to know who they need to speak to, or what part of our team that they're going to be connected with. They just call us and we take care of it. Then I find that after they start interacting with our team, they'll start interactions with messaging because they find it's super easy. We're very responsive, and again, it's a medical provider responding to these messages. Unless, of course, you need to speak with our billing team, whatever team is involved will connect with you. And then this is just a screenshot of where members can add their family members. So whenever I go into a new group, I encourage them first, log into your Amaze Health app, get that set up, get yourself set up for success, and then add your family members. Get your family members set up for success. So once an individual adds those family members, if they are over the age of 18 and they have a separate email address, this actually triggers their own welcome email to that family member, where they can set their own password, download the Amaze Health app, and have access to everything completely independently of that primary account holder's account. If they're under the age of 18, they are considered minors for our purposes and just associated with that primary account holder's account. There's a health summary page, which I always encourage members to fill out ahead of time with their medications, allergies, past medical history. If it's not filled out ahead of time, no worries at all. Our medical team can also update this and keep this updated as you work with our team. But it's nice to have if you already have it filled out. And then it's exportable, so if you have a local doctor's visit, you can share this via email or SMS and send it over to your local provider's office so they have that in hand as well. We do have an insurance dashboard that I like to touch on because a lot of these programs that Amaze Health is included in overlay maybe other major medical benefits. So employees may also have some sort of major medical insurance. And as you know, we do not file claims on insurance, but we will work with whatever plan they have, helping them navigate that. So there's an insurance dashboard where they can upload their plan information, and it's connected to a clearinghouse that gives real-time deductible information, out-of-pocket max information, other important insurance details. So again, our team can use it, but I also find that many members love that everything is within the Amaze Health app, so they don't have to fumble between apps when looking for this information. And then two smart triggers that I like to touch on is when someone initially downloads the Amaze Health app, they'll get a notification to share their location and their calendar with our team. I promise we are not tracking day-to-day location or where dinner is at on Friday at 5, but we've implemented some really cool features, honestly. So we've put some geo-fencing around local emergency room parking lots. So say it's late at night, a patient forgets that they have Amaze. Maybe they have a child that's running a fever, been vomiting, they can't get a hold of that pediatrician, so they head to their local emergency room. Very common, logical next step. Once they pull into that emergency room parking lot, they'll get a notification to call Amaze. if they decide to speak with our medical team, I always say there's 3 things that could happen. The first being maybe it's something our providers can treat appropriately, send them home, check in on them in the morning, saving them that hospital bill. Maybe it is something that needs to be seen in person, but maybe not at that high level of service as an emergency room, and maybe we can find them an after hours urgent care that's down the road where they can be seen instead. Again, hopefully cost controlling that experience for them. Or maybe it is something that truly belongs in the emergency room. And of course, we're going to let them know that, but we're not just going to send them to the ER and that's it. Many patients like to bring us on the phone with them into the emergency room to really be a liaison between providers and help further answer questions. It can be very hectic in the ER, and so sometimes we can help support that situation. At the very least, we're calling the emergency room ahead of time, giving them a warm handoff, letting them know what's going on, maybe bypass this individual having to be in the waiting room at all. And then we're gonna follow up afterwards. So we're gonna check in after they've been discharged, make sure they understand their discharge paperwork, that their prescriptions are ready to go, their follow-ups are scheduled, and then of course review that medical bill for them as well. And then for the calendar-based notifications, if you decide to share your calendar with us, it just picks up on keywords: physical, doctor's appointment, dermatology appointment. There's just a lot of things that we can do if you're seeing a local provider, maybe ahead of time. Maybe you just want to confirm they're in network with your insurance or that they're accepting new patients. Or maybe you want to see if you can get in sooner. Some of those specialty visits these days are booked out months and months, 6 to 8 months, maybe to see a rheumatologist. And so maybe we can find you someone sooner or work our own magic to get you in to see someone sooner. Or maybe you just want to have a consult before a consult. Really know what to expect for that specialty visit. Make sure you have all your questions in line, maybe order labs or imaging ahead of time so you're fully prepared. I've already touched on this, but there is within our resource section, there is our education center. It's called Learn.Amaze. And so that is where you'll find that, or new members will find that. They can go take a challenge, a health assessment, or just learn a little bit more. We also send out weekly educational emails to our members. And this is a big piece within these wellness programs is reading and engaging with those emails. And so usually if there's a topic in our e-learning center, we're also developing some content for our educational emails as well. So that really rounds out our services, the app, some special features in the app, kind of what we do. Like I said, usually when I start with a new group, I encourage them, they don't need to remember everything that we do. They don't need to know who to call except call Amaze. So whenever they have a healthcare question, a healthcare need, we're again here to be that independent healthcare partner here guiding them so they can utilize all the benefits within whatever program they're enrolled in, as well as any other coverage effectively and efficiently. So I will kind of end here and maybe open it up to some questions.
Yeah, absolutely. Great job, Megan. I mean, that was awesome. I love that insurance dashboard. I mean, it looked really clean and it's easy for people to understand. And I just want to remind everybody on the call that, what we're doing with Amaze Health is just a piece of what we're doing with the employee retention plan. What I'm trying to say is you should be encouraged by that. I mean, Amaze Health is very well-rounded, and it'd be a great benefit to your clients. And speaking of the insurance dashboard, this first question kind of plays into that, which is the platform mobile friendly?
Yes, the platform is mobile friendly. The platform is within the app, and if you log in via like a mobile web page, you would still have access to that. I highly encourage the app just because it's a little bit more user friendly than our mobile version, but you do always have access to it.
I figured so, just wanted to double check. Next question here says, can you get connected with a therapist for mental health?
Absolutely. So our counselors, it's very individualized. So I know that that can be somewhat confusing because we're not a standard EAP program where maybe you get 5 visits with a counselor or a therapist. It's individualized. We're working towards finding solutions and building those skills, those coping skills, and identifying triggers really effectively from the get-go. So they'll develop a treatment plan that might be seeing our counselors once a week, twice a week initially, and then, like I said, at any point, if someone needs that long-term or very specialized therapy, maybe family, really specialized deep family therapy or PTSD or something along those lines, then we're going to case manage that. We're going to hold that member's hand, find them a therapist within their local community, vet that therapist, develop a relationship with that therapist to get them set up for success. And then at any point, if symptoms return, or really, we're going to still be checking in along the way anyways, but they always still have access to our medical team, our counselors, our therapists, our nurse practitioners. I hope that helps. I know it's a very unique model that we have here.
Right. No, I think it's great. So I guess my question is, somebody close to me is dealing with some mental health, and they're trying to get connected to a therapist, within town. And the only problem is, they've contacted 50 therapists, and 48 of them aren't taking new clients, and the other 2 are, all booked out till X, Y, and Z date. So I guess what I'm asking is going through Amaze and trying to get a therapist, are you able to jump through some of those loops and get connected to somebody quicker? Is it locally? Is it completely online? Do you have the option? What's that look like?
Absolutely. So once establishing with our team, we're going to get you working with our team, especially if a local provider is booked out months and months. So we're going to work with you first and foremost, and then it's a little funny, and I say this from experience, because when a medical provider office or a medical provider calls another medical provider's office, explains the situation, explains the urgency, or why they need to get in sooner, we often get that to happen. So it's a unique and kind of funny situation, but a lot of times we are able to do that. And then we work with whatever benefits that an individual may have, whether they have an EAP program through their major medical, whether they have other maybe mental health services that are available through their coverage or their medical benefits, or if we need to find cash pay options, we will find cash pay, sliding scale options. I do have, one scenario where we were able actually to find an individual therapy pro bono. So we're going to be that advocate. We're going to find that. We're going to take that on ourselves while working and with the patient, stabilizing the patient, and really finding them the support that they're going to need, and not just, handing them off.
Right. No, I totally get it. I appreciate that. It looks like we have another question here. It says, is Amaze available in all 50 states?
Yes, we are nationwide. We're based in Denver, but our providers are everywhere throughout the country. So you can be anywhere, you can be traveling within the United States. And honestly, we have patients and members call when they're on vacation in other countries as well. Mexico, overseas, medical things pop up, and it's really nice to have a partner, especially in a foreign area, where you can lean on, even if it's something where we can't prescribe the medication in a foreign country. Most often we can direct you appropriately. If the medications are available over the counter, like antibiotics in Mexico, for example, we'll tell you what antibiotic to go buy, or at least find you the resources locally.
Cool. Looks like we're running short on time. We'll answer 1 or 2 more questions, and then I'll have somebody here at ORG address the rest personally with the agent. But one of the questions here says, and this is probably another easy yes, but is the app available both on iOS and Android?
Yes. Yep, it's available on both platforms. And then again, members can log in at amazehealth.com.
Cool. And then another quick question here is, I guess pretty much what the agent is asking is, how does like pricing for the platform work? Is it free? I guess give some detail behind that.
Yeah, so kind of two scenarios here. If, enrolling with some of these wellness programs, Capstone Health, for example, we're funded through that program.
Right.
If, outside of some of these cafeteria 125 plans, we are a per employee per month subscription-based model. So there's no additional cost. Like, all of our services are included in that monthly fee, so to speak, regardless of the way that comes in. So there's no, additional fees for mental health or primary care. It's all included.
Right. Cool. We'll do one last question, and this agent is asking, does this work with any medical provider?
Yes, absolutely. We are completely independent. We are agnostic. We work with whatever provider an individual has or a company has. And so we help them actually navigate those benefits even more effectively.
Perfect. Well, hey, we have a few more questions, but we'll address those after the webinar since we're running short on time. Before we go, you have any last remarks or anything you want to mention? I mean, the only thing I got, and I was going to pull a classic dad joke, and I was going to say this webinar has been amazing. I was going to say it seriously, but I couldn't do it.
Yeah, it's tough. I mean, that never gets old. It's always a fun play on words. But really, just, if you have questions, I'm a resource. Our team is a resource. If you're presenting to a client and you want to lean on us as well, we're always available. I know, Jacob, you have my information, so don't feel, awkward or uncomfortable reaching out to our team. We are here to support you and your clients.
Absolutely. Well, cool, Meg. I appreciate you hopping on here. I know you're plenty busy, and I appreciate all of our agents and advisors hopping on this call too. I know they're plenty busy as well. If you have any questions, you can reach out to your org representative here. You can reach out to me. We'll get you connected with Amaze. Do whatever we need to, help get you up and running. Like I said, this is just a piece of the employee retention plan, but we wanted to get it in front of you all, make sure you know what you're dealing with on this side of things. And we love Amaze. It's been a great partnership so far. We look forward to continuing to expand on that. As far as updates go here at ORG, stay up to date for our upcoming webinars, and we'll keep rocking and rolling. Once again, appreciate your time, Megan.
Yes, thank you, everyone. I look forward to working with you. Have a good day.
Yeah, bye.
Bye.